If you suspect you have some degree of abdominal separation, or if you fear that you've reopened a pre-existing diastasis recti, I'd like to show you how to check yourself at home so you can know the answer to that question. First of all, you're going to lie down on your back in a classic crunch position, and you're going to have your knees bent, feet on the floor. Now, when you place your fingers along the midline to check for both the width and the depth of the gully between your rectus abdominis muscles, it's very important that you point the fingertips lengthwise down the midline towards your pubic bone. And then you're gonna press your fingers into that gully at 3 points, at the belly button, about 2.5 inches below, and about 2.5 inches above the belly button. And at each measurement site, as you press down, I want you to lift and lower your head a few times. Now, how high you lift the head is very important. Most people lift their head way too high off the floor and then they get an erroneous measurement. Because as you lift your head higher and higher and higher, what happens with the abs is they barrel forward and then they start to come together in a sort of under pressure condition. So if you lift your head way off the mat, your abs kind of push forward and then come together, and you might be like, oh, I just have a 2-finger separation. Whereas the real measurement is where the muscles are at rest. So you wanna just barely lift the head off the floor, because that is the moment where the muscles trigger. And you just wanna feel that first moment of activation where they go from passive to active, and that is the moment where you really know how far apart your muscles are when at rest. So you might lift and lower your head a few times just to see and be really clear, like whether or not you're between the muscles. But once that's clear, when you're getting an accurate measurement, you need to barely lift the head up and just let the muscles squeeze the fingers. The width measurement is how many fingers fit in that gully. For depth, you want to note how deep do your fingers sink. Is it to the nail bed? Is it to the first knuckle? Is it past the second knuckle? How deep can those fingers sink into that tissue between the two muscles? And that will improve over time as you do your core compressions, as will the width. If you find that you can easily sink 2 fingers into that separation, that indicates that it's probably 2.5 centimeters or wider, which means you do have diastasis recti. If that's the case, don't sweat it. Our Reclaim program is proven to resolve the condition. So I would encourage you to switch to our Reclaim program and then come back to Surpass after you've closed that separation. If you have no separation, then you're great for Surpass, or if it's just a very mild non-clinical separation, you are also where you belong in Surpass. People often ask me, can you get a 0 separation? And no, you actually cannot. That's not technically possible at the belly button. There will always be 1 centimeter gap between the rectus abdominis muscles right at the belly button. However, above and below, optimal condition, your abs will be butted up next to each other, and you can kind of feel like a couple millimeters distance, but they're essentially touching. So no, you can't have a 0 separation, but 1 centimeter is the goal at the belly button, and essentially a couple millimeters or less is the goal above and below. What if you find a gap that's a little bit bigger than optimal, and yet it doesn't qualify, it doesn't meet those diagnostic criteria for diastasis recti? Well, what I encourage you to do is to continue with Surpass, but instead of doing 2 minutes a day of our core compressions, bump that up to 10 minutes a day until you do achieve that optimal distance between the rectus abdominis muscles. So again, that's 1 centimeter at the belly button and essentially no distance above and below, less than 1 centimeter for sure. Many women follow our Surpass programming and workouts when they're trying to conceive in preparation for a safe and fit pregnancy. If you do become pregnant, first of all, congratulations. But secondly, remember to switch from Surpass to Prepare. That is our pregnancy safe program to help you enjoy a fit, healthy, active pregnancy and to prepare for an optimal birth and recovery. Wherever you are in your journey as a mother, we are here to guide you and to coach you to optimal core health and fitness. I am so glad you're here.